Welcome back. I'm Melinda Torres, and in this module, we're going to discuss various laws pertaining to smokeless tobacco, the various forms of smokeless tobacco, and the health effects of using smokeless tobacco products, as well as the statistics surrounding the damages that smokeless tobacco causes. Much of the state laws are the same for smokeless tobacco as they are for cigarettes. All of the rules regarding sale or gifting cigarettes to minors apply to all forms of smokeless tobacco. When it comes to the federal regulations, there are quite a few new rules that have been implemented as a result of the 2009 Family Smoking Prevention and Tobacco Control Act. For example, all smokeless tobacco products must contain warnings such as, this product can cause mouth cancer, this product can cause gum disease and tooth loss, this product is not a safe alternative to cigarettes, and smokeless tobacco is addictive. In fact, the federal government considers smokeless tobacco products to be such a concern to public policy that the Family Smoking Prevention and Tobacco Control Act requires these statements to be placed on two main sides of the packaging and take up at least 30% of each of those sides. One of these statements must also appear in any advertisement endorsing any smokeless tobacco product and take up at least 20% of the advertisement area. The federal government has utilized the Family Smoking Prevention and Tobacco Control Act in order to crack down on many areas of concern pertaining to smokeless tobacco. The act bans the tobacco brand sponsorship of sporting and entertainment events or any other social or cultural event. Smokeless tobacco products cannot be advertised on any medium of electronic communication regulated by the FCC. As such, television and radio advertising of smokeless tobacco products is illegal. Unless an advertisement appears in an adult-only venue, any audio-visual advertising is restricted to black text on white background. It cannot include any images, music, or sound effects. The purpose of this is to help reduce the advertising of tobacco products to minors. So what exactly is smokeless tobacco? Well, smokeless tobacco comes in a variety of forms. The list is almost endless, and as the International Agency for Research on Cancer points out, the list includes such products as chewing tobacco, dry snuff, moist snuff, snus, as well as dissolvable tobacco products. Dry snuff is inhaled through the nose. Moist snuff is often referred to as dipping tobacco or such colloquial terms as chew, chaw, dip, rub, daps, and spitting tobacco. A portion of the tobacco is placed between the lip and gum. Snus is somewhat similar to moist snuff, though it is placed under the upper lip. Newer dissolvable tobacco products have come to market apparently in response to smoke-free laws and policies around the country. These products deliver nicotine by dissolving in the mouth. When it comes to negative health effects that result from smokeless tobacco, the federally required warning labels only touch the surface of health concerns. Using smokeless tobacco can lead to a large number of negative health consequences, including mouth, tongue, cheek, gum, and throat cancer, cancer in the esophagus, stomach cancer, pancreatic cancer, increased risk of heart disease, heart attacks, and stroke, receding gums, bone loss around teeth roots, cavities and tooth decay, tooth loss, stained and discolored teeth, and very bad breath. Think of using smokeless tobacco products as the exact opposite of brushing your teeth combined with the exposure of toxic cancer-causing chemicals. For this reason, it's important that we encourage members of our university and community to stop using smokeless tobacco products. So how many members of our community are even using smokeless tobacco? And who are they? Well, in the United States, approximately 5.5% of individuals age 18 to 25 say they are current users of smokeless tobacco products, and an overwhelming majority of smokeless tobacco users are male. In the U.S., 9 million people use smokeless tobacco products annually. While these statistics are troubling and certainly indicative of a major health concern facing our society as a whole, there are some less commonly quoted statistics which are also of concern. Dissolvable tobacco products are relatively new and their health effects have not been fully researched. However, research has shown that between 2006 and 2008, 13,705 tobacco product ingestion cases were reported to Poison Control. Of these, 70% involved infants less than 1 year of age. This research indicated that smokeless tobacco products were of a major concern, and in particular, the candy-like appearance of dissolvable smokeless tobacco products. Understanding the prevalence and dangers associated with smokeless tobacco can assist us in providing common sense tips for members of our community that are in some way connected to smokeless tobacco. The more we know and the more knowledge we continue to acquire regarding all areas of health education and AToD prevention, the more powerful of an asset we become in our ongoing mission to make our community a healthier, safer place for everyone. So then, once again, it's time for another Quick Check quiz. Before taking this Quick Check quiz, ensure that you watch the video on health effects of smokeless tobacco and review the document which provides a visual representation of the various types of smokeless tobacco products. As always, the Quick Check quiz is designed for self-assessment. If you don't get all the questions right, you will have a chance to review the material again before retaking the Quick Check quiz. Once you've completed the Quick Check quiz, you will unlock the next section on smokeless tobacco ingredients, marketing, myths, and prevention methods.